Hello and welcome to another episode of Pop Health Hub, where we discuss all things population health management. I'm Bob Canals, Administrator of Business Development here at Populitics, and I'm joined in the studio with Zach Jones, Senior Sales Executive, Populitics Health Management Solutions. Welcome to the studio.
Thanks for having me, Bob.
Companies seem to be craving different solutions, right? I think you mentioned the fact that it's not a sustainable model. Mm-hmm. So what's driving that interest? What are some of the solutions or differences, if you will, to the standard arrangements that employers have been used to for more than a decade?
Yeah, so I think the first thing is when you start to look at the different things that a business, what they spend money on, they start to think about their buying process with those different items. So if you have a manufacturer that buys a lot of goods, they can negotiate directly with those vendors. They see the contract, they understand what it is, and then if they don't like that contract, they don't like the terms, because it's transparent, now they're in a situation where they can say, you know what, we can go to your competitor, or let's negotiate a better deal. And they start to realize that, hey, the cost of those goods is only half the price of what we spend on our healthcare premiums. And so they get to the point where they're like, wait, what do we spend money on in healthcare? Is there a better way to do this stuff? And so I think you have to kind of take a step back and just kind of break out, what do you actually spend money on in healthcare? And there's really four pieces. The first is professional services, which is just going to your regular PCP. That makes up about 25% of an overall healthcare budget. From a volume perspective, it's the most, right? It's also the least expensive. Going to see the doctor, maybe $100, $150 total for a claim, but you have a lot of those. The second piece is inpatient claims. That's when people actually go into the hospital, they get a surgery done, they stay overnight, they have a baby, things of that nature. That makes up another 25%. It's also very small. Those claims are way more expensive, but they typically end up, being, around that quarter of the spend. The other 25% is outpatient, right? So you can go get a quick, surgery done, and then you're home that same day. Falls along the same kind of line as the inpatient stuff, around 25%. And then the last piece is the pharmacy, right?
Yeah.
What do you pay for your prescription drugs? And that's about 25%. And so as you start to see groups that are self-funded and really get access to a lot of this information, what happens is you start to see them say, hey, you know what? Take prescription drugs, for example. Are there other ways outside of our pharmacy benefit manager to be able to procure these medications at a lower net cost? And there is. That's typically one of the lowest hanging fruits is the prescription drugs. Some of the things that you can do in that space. An example would be is there's patient assistance programs and grants out there to be able to procure some of these high dollar specialty medications at little to no cost. And so you'll have employer-sponsored plans that are executing on some of these solutions. So that's just kind of one example.
Yeah. So what I'm hearing from you really a couple of times now has been the lack of control over those costs.
Correct. Companies
are doing a lot of these alternatives, these new initiatives to really gain better control over their costs. Is that a fair statement?
Yeah, I mean, look, we don't have to talk about the health insurance space. Like anything you see in the media today, and I'm not trying to get political, but people are always jockeying for control, right?
Sure.
Want better control over their life, better control over their work, and better control over their company and the earnings that they can get from it. And so when you start to realize that you don't have much control inside of something that is really expensive, you start to question things and say, well, is there a way to get control? I think the other thing too is that the kind of broker or consultant world, there's kind of this contingent of folks that they're trying to differentiate themselves.
Yeah.
And so they've looked at some of those opportunities and said, hey, if we can kind of ruffle the feathers of some of these businesses, we can bring them on as clients, right? And acquire, more accounts that we're managing. And so if we go in telling the same story our competition is, there's really no reason for those employers to switch, right? And so we have to attack those pain points. So yeah, control is probably the biggest word. I think that's where the bell goes off, is when somebody says, hey, wait, hold on a second. You're telling me I can control this better, right? I can manage the cost better. Doesn't necessarily mean they're going to execute, but they're going to listen.
Yeah. Yeah, interesting.